The idea of doing a day on neurodegenerative disorders means that we focus on illnesses that primarily affect the brain, which are illnesses like dementia of all the multiple causes, certainly with Alzheimer's disease. We touch on things like Huntington's disease, which is uncommon, but identifies a lot of problems that people have. We also spend a lot of time talking about Parkinson's disease and motor neuron disease. The reason to talk about these illnesses are that we can make a big difference to the quality of life with people right throughout their illness, but also we're going to be focusing on the last part of their life, which we have to remember is often a long time. With Alzheimer's disease it may be up to 10 years, with Parkinson's disease it's 20 years. So the whole focus of the day is on managing people who have multiple problems, both physical, cognitive and emotional, and also the effect on their families and how we help people manage through that. When people talk about advanced care planning, but the thread is how health professionals work with people to understand their illness and the implications of that, and out of that often falls plans or discussions or decisions about how people wish to live their lives. There are formal sessions on how to approach that, but in the context of managing people who often have cognitive disability, that is, that they struggle to understand what is going on, they cannot remember discussions, and it's how to support them and their families through what is probably a more difficult process than with other illnesses. I think the really important issue that we try and lead into is that we do have to remember that for the majority of these illnesses, all of the treatment is in fact palliative, in the sense that we cannot alter the trajectory of the illness. There is no treatment for Alzheimer's or Parkinson's disease, Huntington's disease or motor neuron disease that really affects the course of the illness. When we end up approaching what we would call end-of-life care, which is the terminal phase of the illness, then there are many issues, and how well they're managed depends on the lead-in to that particular time. So when we're managing the last few days of life, often there are issues around immobility, eating, drinking, whether to use medication or not. How do we determine whether people have pain when they cannot communicate effectively? So often people are cognitively impaired or they can't actually speak. So we look at ways of working with patients and the concerns from their families about how physically comfortable they are. So these problems are not necessarily different from other people, but they are often at the end of a very long illness, and particularly the patients with dementia, they haven't been able to communicate for a while. So we often focus on the nursing issues, in particular on how to physically care for these patients, and how to use non-pharmacological methods. But there are a lot of other ways of managing physical comfort and support, and the other thing is relieving distress and not interpreting distress as pain. And also the challenges in that, and we try and get people to, or the participants in the session, to volunteer their experiences and their solutions to various problems, because not everybody knows everything. I think the people who find it valuable are people who work with people over longer periods of time. So certainly general practitioners who have an interest in often aged care, or people who have these particular sets of illnesses, which actually means almost every general practitioner, but some are more interested in than others. Certainly nurses in aged care facilities, also district nurses, people who work in the community, and nurses in general practices or primary care agencies who work with people over long periods of time, people who are working in social work and allied health. There are a number of people who work on patients who've had stroke, for instance, who have cognitive impairment, or people with Parkinson's disease who have mobility disorders. Is understanding the progressive nature of the problems. So almost any healthcare professional these days who would work in this area, it is very useful for people to have a working knowledge of the illness. It cannot be designed to educate people from the start. So it's meant to be a shared discussion led by us who are theoretically experts, who have a great deal of experience but are willing to facilitate discussion and provide extra support for problems which inevitably arise.